Hello, everybody. Welcome to tonight's webinar. We are going to get started right away. And before we begin, I would like to acknowledge that this presentation was created on the traditional and unceded territory of the Coast Salish people, including the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. Here we promise to learn, live, and share educational experiences on this traditional territory, and we express our deep gratitude. Tonight's webinar is called Could Gluten Be the Problem? And I'm excited to jump right in and introduce you to our speakers. So I am one of our speakers tonight. My name is Nicole Byrom. I'm a registered dietitian with Celiac Canada. And I'm joined tonight by Meagan Vurzinger, who's a dietitian working at BC Children's Hospital in the Division of Gastroenterology, Hepatology, and Nutrition. Thank you so much, Meagan, for joining us tonight. And
Hi, everyone.
Meagan and I are both in BC, enjoying the nice sunshine right now. So you may have symptoms. I had to use this image because this dog was just so darn cute. Many of you today may be wondering if gluten is the root cause of your health-related symptoms. And we know that gluten can cause a range of symptoms from neurological complications to joint pain, digestive issues like gas or bloating, diarrhea or constipation, or other atypical symptoms such as iron deficiency anemia, osteoporosis, or infertility. Do your symptoms have to do with celiac disease, possibly a wheat allergy or gluten intolerance? Well, let's dig a little deeper tonight and find out if gluten may be the cause of your health problems. So let's get started talking about some of these different conditions that I was mentioning. So first, let's discuss celiac disease. I'm going to cover this just briefly, and then Meagan's going to go into much more detail later in the presentation about celiac disease. But celiac disease is not a form of a food allergy, as many people may think, but rather it is an autoimmune disease where the immune system reacts against the protein gluten. Gluten is found in wheat, rye, barley, and their crossbred grains. And gluten is a plentiful and widespread in our food industry, and it's difficult to avoid. And this is why when you have celiac disease or wheat allergy or a gluten tolerance, this requires the support of a knowledgeable registered dietitian and a larger community to support you like Celiac Canada. Here we can see the damage that celiac disease can do to the lining of your gut. You can see here in this image, it's showing the progression of a healthy gut with tall finger-like projections where nutrients are absorbed easily, later to stages of celiac disease where the protein gluten has damaged the villi, causing it to become flat, decreasing the absorptive capacity of the surface. This is why a diagnosis of celiac disease is so important, because the sooner we catch this autoimmune disease, the less long-term damage that will be done. Meagan's going to speak a little bit more about this later in the presentation. So next, we're going to discuss non-celiac gluten sensitivity. This is also known as gluten intolerance. Here, symptoms may present similar to that of celiac disease, where you have GI upset, such as abdominal pain or bloating or fatigue. But non-celiac gluten sensitivity is frequently a self-diagnosis. And because of this, the true prevalence is difficult to establish. And there are currently no biomarkers for this disorder. So what I mean by that is there's no blood work that we can do to test you for non-celiac gluten sensitivity or gluten intolerance. Whereas with celiac disease, you can go in and get your blood drawn and get your TTG IgA tested or your tissue transglutaminase tested to see if you have the marker. Whereas for non-celiac gluten sensitivity, that doesn't exist. The clinical symptoms of non-celiac gluten sensitivity and celiac disease overlap, making this difficult to distinguish between the two disorders on the basis of symptoms alone. Symptoms that overlap may be bloating, abdominal pain, or diarrhea. Symptoms also may mimic irritable bowel syndrome, further complicating a diagnosis. Other intestinal manifestations include nausea, acid reflux, mouth ulcers, or constipation. And individuals may have non-intestinal symptoms like feeling unwell, fatigue, headaches, foggy mind, numbness, joint pain. And an individual may have one or several symptoms. What's most important, and what I really want to drill home, is that for all public health professionals and our community is to understand that a diagnosis of non-celiac gluten sensitivity or gluten intolerance should not be made without first excluding celiac disease. And a gluten-free diet should not be initiated or started without a proper clinical assessment that includes serological testing, so that's blood testing with the tissue transglutaminase antibody, while an individual is on a regular gluten-containing diet to rule out celiac disease. So I'm going to just repeat that again because it's such an important take-home message that if you suspect gluten might be a problem for you, we need you to stay on a gluten-containing diet. So we need you to be eating gluten and get yourself tested for celiac disease before you move on to assuming you might have a gluten intolerance or non-celiac gluten sensitivity, because it is very important to know whether or not you have celiac disease. I often describe to my patients that celiac disease is like a strong foundation of your house. If you build your house on a weak foundation, and that's your gut, you're not going to have a strong home above it. We're never going to be able to truly treat the problem unless we get to the root of the issue. We need to know that your gut is healthy. And if those villi in your gut are damaged, then we're going to have absorptive issues, and that's going to lead to further complications later on. And Meagan is going to discuss those long-term complications of celiac disease later on in the conversation. A treatment of non-celiac gluten sensitivity is a gluten-free diet, much like the treatment for celiac disease. However, in this case, some people can tolerate a small amount of gluten, but this is an individual assessment that needs to be done for you as an individual with your specific health condition. Next, we're going to discuss dermatitis herpetiformis, which is also known as celiac disease of the skin. This is a chronic skin condition with a characteristic skin rash that has intense burning and itching. The prevalence of DH, dermatitis herpetiformis, is about 10 cases per 100,000 in the population, and it occurs more commonly in men than it does women. The onset is frequently in the 2nd to 4th decade of life. DH is more rare in children, and about 10 to 15% of patients with celiac disease have DH. A new unscratched lesion is red and raised and usually small with a little blister in the center. However, when it's scratched, it can become encrusted. A burning or stinging sensation can be very intense, and the most common areas where we see DH is the elbows, knees, back of the neck, scalp or upper back, or your rear end area. Facial and hairline lesions are also not uncommon, and the rash tends to be symmetrical in distribution. DH can be diagnosed with a biopsy taken from the uninvolved skin adjacent to the blisters. A vast majority of patients will also have features of celiac disease, such as villus atrophy, but you do not require an additional small intestinal biopsy to confirm this diagnosis if you have had a skin biopsy done already. Treatment of DH consists of a gluten-free diet and medication. Oral dapsone is often used to treat the skin rash, and the response is often dramatic, with rapid relief of burning and an improvement of the rash, but remembering that a strict gluten-free diet should be consumed. Finally, we're going to discuss a wheat allergy. So a wheat allergy is sometimes confused with celiac disease, but these conditions are actually very different. A child or an adult with a wheat allergy is likely to develop signs or symptoms within minutes to hours after ingesting something containing wheat. Wheat allergies often present with symptoms such as swelling, itching, irritation in the mouth or throat, hives, an itchy rash or swelling of the skin, nasal congestion, headaches, difficulty breathing, and of course, anaphylaxis. What sets a wheat allergy apart is it's the only gluten-related reaction that you need an EpiPen for. Patients are treated by allergists rather than gastroenterologists. A complete avoidance of wheat is necessary when you have a wheat allergy. And many of you may have noticed that on some labels, you'll notice that there's a gluten-free symbol, but there's also a may contain wheat as a precautionary symbol or precautionary statement on the packaging. Anything that is labeled gluten-free, we know is safe for people with celiac disease. However, those living with celiac disease can tolerate up to 20 parts per million of gluten. However, those living with a wheat allergy cannot tolerate any wheat at all. Therefore, that may contain wheat is for those with a wheat allergy and not for those living with celiac disease. So anytime you see a gluten-free symbol, it is safe for somebody with non-celiac gluten sensitivity or gluten intolerance or celiac disease or DH, but not for that person living with a wheat allergy. Next, I'm going to pass the mic over to Meagan, and she's going to go into a little bit more detail about celiac disease. Thanks so much, Meagan.
Thank you, Nicole. Next slide, please. All right, so there is a strong genetic component to celiac disease, which is important to be aware of. The risk for developing celiac disease is actually about 10% higher for those who have a first-degree relative with the disease, but it can run in families as well as in second-degree relatives, which means aunts, uncles, nieces, nephews, grandparents as well. It occurs commonly as well in patients with other autoimmune disorders. Therefore, screening of these high-risk individuals should be considered. Next slide. So there are some challenges of diagnosis. A 2021 study describes that well. It looked at celiac disease antibodies in a large group of over 16,000 participants, where the main focus of the study was testing stored blood samples, which were drawn between 1976 and 2012. So of the 173 participants who tested positive for celiac disease from that group, 168 of those 173 did not know about their diagnosis at the time of the blood draw. So quite a large proportion. This speaks to an underdiagnosis rate of 97%. Also, there was no significant difference in reported general or abdominal symptoms between the two groups, those with celiac disease versus those without celiac disease. Recent evidence also shows that classic GI symptoms are no longer considered to be the primary presentation of celiac disease when patients are first diagnosed. Next slide. So we just discussed that classic symptoms, those gastrointestinal symptoms that you may commonly think of as being associated with celiac disease, may not be there for everybody who presents with celiac. However, they're still common and important to be aware of. So some of these symptoms include things like abdominal distension, abdominal pain, chronic diarrhea, loss of appetite or anorexia, irritability, weight loss, or failure to thrive in children, muscle wasting, or dermatitis herpetiformis, which is, as Nicole mentioned, celiac disease of the skin. Next slide. So non-classic symptoms are definitely very common with celiac disease, and some of these non-classic symptoms include things like unexplained iron or folate deficiency anemia. 9% of those with unexplained iron or folate deficiency anemia have celiac disease when they get screened. Other non-classic symptoms include things like oral canker sores, dental enamel defects, persistent or recurrent vomiting, irritable bowel syndrome or IBS, chronic constipation, abnormal liver enzymes, arthritis or arthralgia, osteoporosis or osteopenia, short stature, delayed puberty, or infertility. So in that study that I recently mentioned, they found that non-classic symptoms were actually reported more commonly at initial presentation of celiac compared to non-classic symptoms. And in this study, they also found that tiredness and headache were among the most prevalent. So as that study discussed, these non-classic symptoms are really important to be aware of since they may be your first clue that you may have celiac and should get screened. Next slide, please. So there is a symptom checklist on the Celiac Canada website where you can enter your symptoms into the checklist to see if you or your child should be tested. We'll just wait for that to come up here. So when you click on the link, it will take you to a checklist where you can enter in your symptoms that you or your child may be experiencing, as well as your name and email, so that you can be emailed with a report that overviews whether you should be screened for celiac disease. And this is intended to be a tool that you can bring with you to your GP, family doctor, or pediatrician to help to advocate for your health and really determine if you should be screened for celiac disease. Next slide, please. So there are some situations where you are at higher risk for celiac disease and you should get screened, even if you are not experiencing symptoms. So some of these conditions that do put you at higher risk for celiac disease include things like type 1 diabetes, autoimmune thyroiditis, Down syndrome, and Turner syndrome, as well as being someone who's a relative of somebody with celiac disease, as we discussed earlier. IgA deficiency is also something that can place you at higher risk for having celiac disease. IgA deficiency can be tested for in your blood work. So it's quite common, as I mentioned, for celiac patients to have IgA deficiency up to 30%. IgA deficiency also makes it harder to get an accurate diagnosis or celiac screen, since false negative blood tests may be observed in patients with IgA deficiency. So ideally, getting serum IgA tests at the same time as getting your tissue transglutaminase level checked would be the best way to prevent any false negative results. Next slide, please. So there are some neurological complications that have been associated with celiac disease and may also be prompting factors to get screened. So some of these conditions include things like unexplained loss of coordination, also known as ataxia, peripheral neuropathy, which means tingling or burning or numbness in the limbs, epilepsy with occipital calcifications, depression or anxiety, fatigue, brain fog, headaches or migraines, and dizziness. Next slide, please. So how do you go about getting diagnosed with celiac disease? Diagnosis of celiac disease happens in 2 steps. The first step is screening. So screening for celiac disease occurs through a blood test. This test will look for elevated levels of the IgA tissue transglutaminase antibody, also known as your TTG level. It is important to remember that during screening, individuals must be eating gluten. So Nicole mentioned that earlier, the importance of continuing to eat gluten when you're getting screened for celiac. If we have celiac disease, gluten intake will trigger these TTG antibodies to be produced, and they will be visible in our test results. The second step involves a small intestinal biopsy or possibly a skin biopsy in the case of dermatitis herpetiformis, which is that celiac disease of the skin. A biopsy is performed by a gastroenterologist using a tool known as an endoscope. Your doctor will take samples using an endoscope to identify if there is any damage to the small intestine. This procedure takes about 30 minutes and it is not painful. A diagnosis of celiac disease is generally confirmed by a biopsy. Next slide. So why do I need to get a diagnosis of celiac disease, you may ask? Well, it's very important to get a diagnosis of celiac disease from a physician, as this ensures that you will receive the proper treatment and follow-up from a team, including a doctor and dietitian in the community. Celiac disease requires regular monitoring of your tissue transglutaminase antibody levels and other nutrient levels, ideally every 6 to 12 months, to reduce your risk for complications and nutritional deficiencies. Having a team is necessary to ensure that the strict gluten-free diet is followed, taking into consideration your own blood work, levels, diet, and symptoms and lifestyle. A diagnosis is also necessary to qualify for claiming gluten-free foods on your income taxes and in case of any future medication developments down the line. Next slide, please. So treatment for celiac disease, there is no permanent cure for celiac disease, but it is effectively treated with a strict gluten-free diet, meaning 100% strict. Adherence to the gluten-free diet must be strict and lifelong. Future medication trials are ongoing, but at the moment, the strict gluten-free diet is the only known effective treatment. Next slide. So what happens if you go undiagnosed or you continue to eat gluten when you have celiac disease? So some of these complications include things like developing malnutrition, lactose intolerance, osteopenia or osteoporosis, which can lead to bone fractures, iron deficiency, infertility, nervous system disorders like ataxia and neuropathy, cancer, as well as growth issues in children. So this just highlights the importance of getting screened and following a strict gluten-free diet if you are diagnosed with celiac disease. Next slide, please. So it's important to highlight that gluten disorders do not discriminate. Anyone who is a child, a teen, an adult, or a senior at any point in the lifespan can get diagnosed with celiac disease. In fact, a recent study showed that children with a first-degree relative of someone with celiac disease already has a 7.5% chance of testing positive for celiac by the age of 3, with an increasing incidence as they age. So it's important to get children tested for celiac disease as well if they're experiencing symptoms or are at higher risk based on those factors that we discussed before. Gluten disorders can also affect people of all genders from all over the world, as well as people who may have been told that they have IBS, since symptoms are quite similar, and people who have lived with their normal for years. So all this to say that it's very important to get screened if you are having symptoms or are someone at higher risk for developing celiac disease. Next slide. So thank you for joining us and for your support. Nicole will come back as well to the screen, and yeah, thank you very much. But please visit our YouTube channel to watch this recording and other Celiac Canada webinars, and visit our website as well.
Yeah, thanks so much, Meagan. So yes, our website is www.celiac.ca. And here, of course, is where you can find the symptom checker. You can find lots of links to other supporting resources, more descriptions on the various conditions that we discussed tonight, and of course, lots of information on celiac disease. So thank you so much, Meagan, for joining me on this webinar today. And I look forward to doing future ones or other webinars in the future.
Thanks, Nicole.
Thanks so much. Have a good night, everybody.